One of the other things I am as well is an urgent care general practitioner, and I've gone into care homes throughout this pandemic. And I wanted to first say the people who work in this setting are amazing. Right throughout the COVID pandemic, they put themselves on the line, and often in situations where they have significant outbreaks in their care home. And if you go, what happened is on 11th of November 2021, we turned around and said, you don't have the vaccine, you don't have a job anymore. So the first thing is you say, well, look at all the effort and all the risks they put themselves to that point in time. And I think what's interesting is that you showed Alan Miller there, is it was very clear about this issue of transmission very early on. I don't understand what facts you can be looking at if you weren't understanding the major impact of this vaccine with those most at risk. So one of the key aspects of healthcare is informed consent. You should be able to understand the benefits and harms of treatment. The idea that you put a mandate on people, a legal requirement to have an intervention, is a really serious issue to debate. One of the key things as well is you shouldn't have any alternative strategy at hand. Remember, and you could have been tested on the way in at the door. So you did have alternative strategies. So even ethically, it wouldn't stand up if you looked at it, the idea of a mandate. But you're right. If we look at it now, the numbers, there are 165,000 vacancies in social care. It's the largest number they've ever been. And these people were putting themselves on the line. So the idea that we persecuted them is now looking back and saying, I'm totally in line with what Alan Miller's saying. And I think if we don't reinstate and compensate these people, we won't bring this back to the important level that being in the care sector is one of the most important jobs we need in the midst of a pandemic. And we need to look after these people who put themselves on the line each day. The petition there is by the Tomorrow Declaration is 23,000 people have signed that so far. And it sets out this basic premise that we want the government, it's going to go to Theresa Coffey when enough people have signed it to say we want an apology to these workers. You've said about reinstating and compensating them. But I also think this also goes to a wider issue at the end of the day, which you're alluding to. This is an important issue for the inquiry, is you have to stop a few people bringing in laws that actually aren't fall through, and we as a democracy have an ability to have input to. And so that's where I think countries like Sweden had a much better legal framework than us with the Coronavirus Act, which meant people could act and within days have these rules, which actually, when you look back, it only lasted 4 months, this mandate. I think it's easy to come on TV and be overcautious and pull the government line. I think what you're saying is, can you say to us, where's the evidence to make these decisions? And when you go back in time, when everybody was in restrictions, in lockdown, highly anxious, people were sent a message. And what you're seeing now is because that's all disappeared, people are starting to ask the important questions.
Yeah.
You're also pointing out, why didn't that happen earlier? I think it's an incredibly important point. And actually, there's only a few bits of the media that have been pointing fingers, but actually it's now widening out because people are starting to open up their eyes.